line, we've got our newfound friend, our long-lost friend, actually, our surgeon extraordinaire. Good morning, Mother Teresa.
Oh, good morning. I wish.
Yes, we're speaking to Dr. Lianna Roodt, who's the founder, director, and hands-on surgeon at Project Flamingo, doing the work of angels out there. So, Doc, we jumped on board with your great foundation with Lotto Star towards the end of last year, and there's a mammoth task ahead of performing 200-odd breast surgeries this year.
Absolutely. I am very happy to announce that we got right into it from about end of October. As it stands, we've already performed 40 surgeries.
Wow.
And Saturday at Groote Hospital, we have another 8 surgeries scheduled. And at all the other hospitals, soon to follow, early in February, lists are full. We are ready to go, go, go. We really, really aim and are on track to complete the 200 surgeries that we set out by October this year.
What do you think is the main cause of breast cancer in particular, or one of the main causes? Is it things you do in your lifestyle, or is it more genetic, or perhaps a bit of both?
Yeah. I think it is the perfect storm, a combination of many factors. So our genetic cancers, if you want to call it that, patients where we can actually pinpoint a genetic mutation, only makes up at most about 5% of the cancers, which is actually a really small percentage. Now, that said, maybe we don't have all the genetic knowledge that we need yet to identify more, but of the genes that we do know, it's only about 5%. The rest of the patients, we're not sure. And I think what we're learning is that it's a combination of lifestyle factors, the usual culprits, poor diet, poor exercise, smoking, obesity, stress, and poor sleep hygiene. Those things all contribute. Like they say, the body keeps the score. And sometimes, it just creates the perfect storm for a disease to actually occur. If you're worried about something, don't sit on it. Go ask somebody, go see somebody. Waiting is not your friend.
So, Doc, just as a sort of rule of thumb, if you're a lady in your 20s, 30s, 40s, 50s, self-exam, hey, would you say in your 20s?
Absolutely.
Self-exam, how often? Once a month, once a month, once a week, once a day?
I would say in your 20s, you can't start too soon with getting to know your own body. So we usually say clinical self-exam once a month at least, about 3 to 5 days after the last day of your period.
Right.
So because then the breasts are less dense, they're less tender, they're less nodular. So you actually have a baseline to compare with every time. So if you notice something new, something different, then you know, okay, maybe I must go and see or ask somebody. And then if you are a patient that has a strong family history, so a genetic risk, go speak to your doctor and let him do a formal risk profile on you to decide when you should start with other forms of screening like an ultrasound or a mammogram. There's various modalities that can be used to help you manage your risk and do your screening. But educate yourself, inform yourself, and get involved with your own body.
Mm. And what age, would you say that women should start going and getting the professional advice? Again, rule of thumb stuff, professional advice as in a mammogram.
So in South Africa, we don't actually have routine screening mammograms as part of our risk protocol. In the US, the guidelines is for women above 40, and the UK and Canada changed the guidelines for women over the age of 50. And I think everybody is sort of moving in a direction where we individualize patients. It's not a one rule for everybody. So for me, I think the best rule is actually go see your gynecologist or your breast surgeon or your GP that's got an interest in women's health between the ages of 35 and 40. Discuss all these things, get a good clinical assessment, get a risk profile done, and then go from there to get your individualized sort of screening protocol done.
Wonderful
That
stuff.
is the scientific way of doing it now.
Okay, so not one size fits all.
Yeah.
But Doc,
No.
your knowledge, insight, and your hands are always incredible. Thank you. We learned a lot this morning once again.
Thank you so much, guys, for the lovely chat and once again for your incredible support. We won't be able to do any of this work if it wasn't for the generous heart of people like you guys.
No. Please. We don't want any credit here. It's all you and your great team of surgeons and the Star Foundation. Thank you very much, Doc. We'll chat again next month.